a student nurse from the University of San Agustin. So may you please know your name and birthday, ma'am?
So my name is Olivia Sway, and you can call me Mrs. Sway. And my birthday is on December 11th.
Okay. So today, Mrs. Wei, I will be performing an obstetrical physical assessment. This is done to determine your overall health as well as your baby's health. Is that okay with you?
It's okay.
Okay. So I'll just wash my hands and I'll be here.
Okay.
So first, ma'am, I will be taking your vital signs. This include your blood pressure, temperature, pulse rate, and respiratory rate. Ma'am. Okay. Thank you. Next, Mrs. Sue, is your blood pressure. Next is we check for the general appearance of Mrs. Wei. So we also need to inspect for careless hygiene like unwashed hair, inappropriate or soiled clothing, and bad facial expression. Mrs. Wei, I will be inspecting your hair. This is part of the damage. Okay. Next is we inspect the skin of Mrs. Wei to note for hyperpigmented areas associated with pregnancy as well as vascular markings. So Mrs. Wei, I will be checking your arms. We also need to inspect the hair and the nails. Other side. For Mrs. Wei, there is no any hyperpigmented that I can note of, as well as her hair distribution on her arms is evenly distributed, and her nails are healthy. They are pink in color. Next is we palpate the head and scalp. So we inspect for symmetry and contour, as well as palpate for any tenderness, inspect the hair distribution, check for the thickness or if there is an excessive dryness or oiliness, and then if there is also any lesions, masses, or dandruff. So I'll be checking your hair, ma'am.
For the hair distribution, the hairs are evenly distributed. No bald areas can be spotted.
Then, okay, do you feel any pain, ma'am?
The thickness is appropriate. There is no presence of excessive dryness or oiliness.
Then we inspect Mrs. Wei's face to check for mask of pregnancy, look for color, pigmentation, and edema. So ma'am, can you please lower your mask? Okay. As I inspect Mrs. Sue's face, there is no presence of mask of pregnancy, and then the color is even on both sides of her face, and no presence also of hyperpigmentation. Next is we inspect her eyes.
So we examine the cornea, lens, iris, and pupil.
So note for the conjunctival color. Using a pen light. There you go. And then I'll be checking your conjunctival. Okay. Equally around and reactive to light. And then her conjunctival color is pink. We inspect the nose for nasal congestion. Mrs. Wei, I'll have you lower your mask. And chin up, please. There is no presence of nasal congestion. And then after the nose, we inspect the mouth, the teeth, and the throat. So for the mouth, we inspect the mouth and pay particular attention to the teeth, if there are any dental caries or dental cavities. And then we observe the corners of the mouth if it is cracked. This way. Say ah.
The teeth are complete and has no dental caries. As for the gingival tissues, they are not swollen or red.
And then we also inspect the throat for any redness or exudate present.
And there were none.
Okay, thank you, ma'am. So next is the thorax and lungs. So we inspect, palpate, percuss, and auscultate the chest, and then assess for the respiratory rate and rhythm, as well as auscultate bilaterally the lung sounds. Okay. And then we percuss. Okay, and then we auscultate using a stethoscope. Okay, ma'am, I'll have you turn around. Okay. This is the heart, so we palpate the apical pulse, which is located at the mid-clavicular intercostal space. Then we auscultate for heart rate and presence of occasional murmur and palpitation. After that, we proceed to the breast and the nipples. So we inspect and palpate the breast and nipple for symmetry and color. Thank you, ma'am. And then we proceed with the back for exaggerated lumbar curves. Okay, thank you, ma'am. Then next is the abdomen. So we inspect the abdomen and note for striae, scars, its shape, and then as well as its size. So I will have Mrs. Sway recline with a pillow under her head and her knees flexed. Mrs. Sway, please lay down. Wait lang, Mrs. So I will lift up your shirt, ma'am. In normal pregnancy, linea nigra can happen or striae gravidarum, commonly known as stretch marks. And then after that, we assess the shape and contour by measuring the fundic height. So for Mrs. Sway, I will be measuring your fundic height using a tape measure or measuring tape. Start here. Okay, you are 32 centimeters. Then we're gonna perform Leopold's maneuver. So first is the fundal grip. So here. Fetal head should be round, hard, and bloatable. Then next is umbilical grip. This is to determine which side is the fetal back. Then the third, Bollick's grip. This is to determine fetal presentation and station. Then fourth is the pelvic grip.
So after we perform the Leopold's maneuver, we also need to determine the location, rate, and rhythm of the fetal heart rate. Okay. Determining their fetal heart rate. For the genitalia, we need to inspect external genitalia and note hair distribution, the color, and the varicocytes and scars. Then we need to observe for presence of discharges, the color, the odor, as well as the amount. And lastly, for the rectum, we need to inspect the anus and rectum, then note color, varicocytes, lesions, tears, or discharge. Then we proceed with the extremities. So we inspect the legs for varicose veins, the hands and legs also for edema, and obtain knee and ankle reflexes as well as observe for waddling gait. So we inspect the legs for varicose veins. Ma'am, I will be checking your legs for varicose veins. Okay. Other side. Wow, sexy. Next is we check for the edema, both hands and legs. So there is no presence of edema on both legs.
How about the hands now?
Next is to inspect for edema and varicose veins. Then we obtain knee and ankle reflexes. Then lastly is we observe for waddling gait.